Good morning. Thank you for coming. I'm New York State Attorney General General Schneiderman, and I'm very pleased to be here today with Police Commissioner William Bratton to talk about a life-saving public health initiative. I'm also very pleased to be joined today by Carol Christensen, whose son Eric was a proud member of the NYPD, but who tragically lost his battle with heroin addiction and passed away. Carol has since co-founded a drug crisis group and dedicated herself heroically to seeing that no one else's children have to go through what her child went through, and I'm happy she's with us today. One of the major challenges facing communities all across New York State and all across America is the epidemic of heroin and opioid abuse. Since my first day in office, we have been dealing with this problem. We've been trying to find tough and smart ways to crack down on the threat, and have taken down some of the biggest and most violent drug gangs in the history of the state of New York. We've sent major kingpins to prison, but we understood from the outset that you cannot prosecute your way out of a drug epidemic. You need to use what we call an all-levers approach that includes disruption of supply, public education, better use of technology, and expanded opportunities for treatment. Today we're here to talk about an important part of the all-levers approach, saving people from dying from heroin and opioid overdoses with a drug called naloxone. Naloxone saves lives. Just 4 days ago, NYPD officers in Staten Island, where they had a naloxone pilot program, saved 2 people's lives. It's the exact reason that we need to, and we are now going to make naloxone available to officers across the whole city. And I'm very proud to announce that the New York City Police Department is joining our Community Overdose Prevention program, or COP program, and we will be providing the NYPD with the funds to equip about 20,000 NYPD patrol officers with naloxone. Because of this funding, about $1 million, every police officer on patrol in New York City will now be able to carry a naloxone kit, putting the power to save lives in their hands. This is all it is, folks. It costs about $60, and it saves lives. The NYPD is the largest, in many of our view, the finest police force in the nation, with more than 34,000 officers. These officers are very often the first to arrive at the scene of an accident, a crime, or an overdose. After a 911 call, very often in New York City, the police arrive well before EMTs or anyone else. And now, people will not have to wait for an ambulance to get naloxone into use so that it can save the life of someone who would otherwise would simply die from an opioid or heroin overdose. Since we announced the COP program a very short time ago, statewide more than 150 law enforcement agencies have requested nearly 25,000 kits. My office has committed a total of over $5 million, which we believe should pay for kits for pretty much any officer in the state that wants them. And if we have to commit more funds, we will do so. We are using the money to buy naloxone from drug forfeiture funds. When we work with the federal government and recover money from joint investigations, much of it, in fact, from drug gangs, we are able to use it for law enforcement purposes, and now we're using a portion of those funds to provide police departments across the state with naloxone, and today is really our most important step in that regard, as the NYPD is far and away the largest police department in the state. It is important to recognize that in New York City, Northern Manhattan and the Bronx are one of the national hubs for the importation and distribution of heroin. Staten Island and Manhattan are among the top 10 counties in New York State for the number of opioid-related hospitalizations per 1,000 residents. And in New York City, heroin-related overdose deaths increased 84% between 2010 and 2012 after 4 years of decline. Since 2010, heroin has been growing as a problem, and it is now interwoven with abuse of prescription opioids and other drugs. It is something we have to fight, and naloxone is an important part of our efforts because it actually counteracts the effects of heroin. The way you die from a heroin overdose is you stop breathing. And naloxone is something that gets people breathing again. It impedes the opioids from constricting your lungs and stopping you from breathing. It is very simple to administer. And the reason that we're able to do the program we're doing today is because naloxone used to only be available intravenously. And it was dangerous to have people in the field injecting folks out on the road. the sooner you get it into someone, the faster and more likely the chance they'll survive. It is now available through this nasal spray. Very simple. Spray half the dose in one nostril, half the dose in the other. The kits cost about $60 each and have a shelf life of about 2 years. It is very important to us that this be placed in the context of our overall efforts to deal with crime. In Suffolk County, there's been a pilot program on naloxone since 2012. More than 170 lives were saved, and the overwhelming majority of those people got into drug treatment as a result of having their lives saved and having the problem identified. Naloxone was effective in 95% of those cases. So in 95% of the cases in which the Suffolk County Police found someone dying from a heroin overdose, that person's life was saved. I think this is a clear-cut step towards getting more people into treatment and to saving more lives. Our all-levers approach to dealing with the heroin epidemic includes public education. It includes making treatment more available. We've reformed our drug laws, and our prison population since 2010 has been going down, while most categories of crime have been going down. We have shut down, as I said, some of the biggest and most dangerous drug rings in the history of the state. We have the iStop program, which is the best program in this country for tracking prescription drugs. We have ended doctor shopping in New York, according to the New York State Health Department. But we have to continue to do everything we can to deal with this epidemic. Again, you cannot prosecute your way out of a drug epidemic. You have to be smart about it. And naloxone is a critical lever in our all-levers approach to deal with heroin abuse. I just want to take a few moments to add something in Spanish. La heroína es matando a nuestras familias. Cada policía de la ciudad de Nueva York ahora tiene otra arma para salvar vidas. Tenemos que combatir los drogas ilegales en todos los frentes. Muchas gracias. And now I'd like to introduce one of the finest people I've ever worked with in law enforcement, our great police commissioner, William Bratton.
Thank you, General. General, thank you, and I want to thank you for your office's initiative as it relates to this drug. We have had the opportunity in Staten Island over the last several months to issue it to our patrol officers over there under another grant program, and to date it has resulted in the saving of 5 lives, 2 over this past several-day period of time. The use of heroin is a growing problem in the city, and what the General will be providing with forfeiture funds, a great use, an ironic use, if you will, of money that was raised through the illegal sale of drugs is now being used to save lives of those afflicted with drug addiction. That the monies that are being made available will allow us to equip about 20,000 of our officers out of a 35,000 person department. You might ask, why only 20,000? Well, effectively the officers who are most directly involved in patrol activities, who might in fact have most opportunity to deal with an individual suffering an overdose. So those 20,000 officers will in fact be equipped with, as he has pointed out, this package, relatively small to carry, has 2 doses in it. And the opportunity is that you can give more than 1 dose if the person that is suffering the overdose doesn't respond to the first dose. You can safely try a second dose, and that in fact occurred with one of our instances in Staten Island. So the NYPD is very pleased to participate, along with many other departments in the state of New York, in this initiative. We are working with the New York City health agencies. We'll be training a significant number of trainers within the department who can then conduct precinct-based training for our officers. It takes about 45 minutes to train an officer on the safe use of this device, and it is something that we anticipate in a very short period of time, several-month period of time, once the actual kits become available, that we can equip all of our patrol officers and related personnel in the field with it. So again, General, thank you very much for the very creative use of the forfeiture funds for something that will save lives. And I'd follow up and emphasizing what the General has talked about, that you can't prosecute your way out of a drug epidemic. You can't arrest your way out of it either. And this is not the total panacea. This is what we would hope would be a first step with somebody coming that close to death with an overdose, that would recognize that they need to do something about their addiction and take this second chance, if you will, to in fact get involved in a meaningful drug treatment program that would allow them to get their problem under control. And I would hope that would be the case, that we're not just saving a life, that somebody's going to go right back out and buy more dope and effectively put their lives right at risk once again. General, thank you.
Thank you very much. Thank you. And now I'm very proud to be joined by someone who, to me, is a hero in this effort. One of the most important things, the essential thing that we have to do in order to deal with the drug epidemic is to change the way people think about it. And Carol Christensen is one of these heroic family members who's lost a loved one, but instead of retreating into their privacy to deal with their grief, has rededicated herself to informing others, educating others. One of the most confounding things about the current heroin epidemic is that heroin does not seem to have the stigma it did 20, 30, 40 years ago. This is not just an epidemic in poor communities. It's not just an epidemic in urban areas. It is in the suburbs. It is in middle-class communities. It's in every part of the state. And for whatever reason, kids have lost the sense that this is not like other drugs, that this is incredibly addictive and incredibly damaging. And Carol, who started a drug crisis organization and is an outspoken advocate all across the greater New York area, is one of the heroes who's helping us turn consciousness around, and it's a pleasure to have her here with us today.
Thank you. Thank you. I appreciate it. Thank you. Hi, I'm Carol Christensen. I could say that if the I-Stop law was in effect over 2 years ago and the NICON was also in effect, possibly my son Eric would be alive today. My son was a New York City detective, and he hurt his back and he got caught up in opiates for painkillers, which went into heroin. Here's a photo of Eric. Does that look like somebody who takes drugs? I don't think so. But part of a drug crisis in our backyard, I co-founded with Susan Salamone and her husband and my husband, Lou Christensen, to bring awareness of what is happening out there. It is an epidemic, and the I-Stop law is wonderful. It's something that should be totally supported in every state. And if June 9th, 2012, if this would have been in effect, possibly Eric would have been alive today. Thank you. Thank you very much.
Thank you very much.
I appreciate it.
Thank you.
Commissioner Bratton, thank you.
Thank you. Appreciate that, and sorry for your loss, but thank you for your courage in helping to prevent others from having to go through the same thing. And now with that, Andrew, we can take some questions.